Hi guys, this is Dr. Sarah Van Dyke coming to you from Dash Chiropractic here in Huntington Beach. I'm here to talk to you today about IT bands. And I'm a runner, so I have a lot of friends who are runners and friends who also coach runners. And IT bands are something that can be very frustrating and very common. And there's a lot of misconceptions about what to do to relieve IT band pain, and that's what this video is going to be focused on. I actually Googled the most commonly searched things about IT bands, and this one was the first thing that came up. So this video is going to be focused on how to relieve IT band pain. And the first thing I want to do is talk to you about things that actually can cause the IT band pain that aren't the IT band. So first of all, what is the IT band? So it's this long fibrous band that connects from the knee and from two muscles. One, this little baby muscle right here called the tensor fasciae lata, or TFL, and two, the gluteus maximus. They will both feed in to this long, strong, fibrous band that just runs along the outside of your thigh right here where this green rubber band is. And oftentimes people will feel knee pain at the insertion of the IT band, or they'll feel pain up here or even anywhere along this band. And it can be really irritating. It can even get swollen, and it can cause a lot of pain, discomfort, and a lot of time off running, which is something that none of us want. So I'm going to show you what you can do at home to help you relieve your IT band pain. And to understand the interventions that I'm going to show, I'm going to go off the assumption that the IT band pain could actually be caused by something spinal based. And there's a possibility that the IT band itself could actually be inflamed, but those cases are actually a lot less than people think. And a lot of times it's something neural causing the inflammation. So let's talk about that. We have our nice skeleton here, as you can see. And this is what the low back looks like if you just take it out and we look at it here. If we take a little piece of that out here, these nerves here, so we have your spine here. This is a lumbar spine, the low back. We have the front of your body here, the back here, and then these are the sides. So spinal cord gives off nerves, and they will come out of the spinal cord just to travel down into the lower extremities. So the nerves come out like so, and they travel down in the front of the pelvis, the sides, and down the back. We're going to talk about the nerves that go down the sides today. And the nerves that come out of here and go down the side can cause IT band pain, and I can show you some mechanical reasons for that happening. So we're going to zoom in really quick on this little spine guy. And as you can see, there's a hole that this nerve comes out of. When that hole gets smaller through lots of spinal extension, the room for this nerve is a lot less. And nerves do not like compression, and it does irritate them. And if they get compressed over and over again, they can actually swell, which makes the hole even smaller because the nerve gets bigger and swollen, just like a sprained ankle that gets swollen. And so oftentimes what you need to do is just de-swell the nerve and calm it down, and also fix the underlying biomechanics that cause that, which often in runners is getting tired and doing a lot of spinal extension like this. We've all seen that marathoner friend who finishes like this at the finish line. Well, you might be also doing that in your workouts and your runs too. So first, let's de-swell the nerve. There's a couple exercises that you can do to do that. I would choose two that I can show you here. One is the door jam squat. We're gonna pretend that my skeleton guy is a door jam, and we're going to shimmy down and put your elbows between your knees and just hang out here. Be comfortable for a solid 2 minutes or so, and then get up and see if it helps you. That could actually relieve your IT band pain. The other thing is to take a handy dandy pillow and just put it under your hip area and just make yourself a rainbow over the pillow and just hang out. I would advise doing this over a couch or something stiffer that you can kind of like dangle this leg down. But if you can't do that, basically you're just trying to open up the vertebral holes in the low back that the nerves go through and give them time. So again, try that for a few minutes, 2 to 3, and see if your IT band pain feels any better. If it doesn't, that's not the correction for you, and it's not nerve-based IT band pain. But that's okay. There's other things that can cause IT band pain too. But before I get to that, we're going to do one more exercise for the nerves, and that is going to be a push bug. This is helping to get the belly wall on to reduce the spinal extension. So really pack your belly into the wall, really push the belly button into the floor here, and push on this wall here really, really hard, and just tap the heel on the ground over and over again. And that's one exercise you can do to try to fix those biomechanics. Now, we're going to talk about one more thing that can cause IT band pain that's spinal related, and that is the lumbar disc. The disc can cause neural inflammation too, and when it herniates, it can pinch upon the nerve as well. So I'm going to try to find a good angle for that if possible. That's not a very good one. So you can kind of see that if we do flexion, that there's a little bulge right there, and that will press into the nerve. See how the nerve's getting pressed on just as if the hole was getting smaller? Same thing. So for disc injuries, I would suggest taking a quick little belly on the floor, hands here like a push-up position, and just doing a press up. Try about 60 of those. It should take you about 6 minutes, and see if the IT band pain goes away. And if it doesn't, it's not disc related. It could also be muscular related, but those are really, really rare, and we actually don't see those come in a lot. And for those, just getting tissue work on the muscles around could actually help your IT band pain, or loading the hips usually does it, honestly. If you just work on strengthening the hips and, work on squats and other deadlifts, other strengthening maneuvers, you should get your IT band pain to go away. Hips, core, those two things are usually really involved in a lot of running injuries, and the IT band isn't an exception. So that concludes this video. The next video about this is going to be myths about IT band pain. Hope you enjoyed it. Leave some comments below if you have any questions. Thank you. Wait a second, before I let you guys go, I made this video originally to teach you guys about how to relieve your IT band pain, but I also wanted to just add a disclaimer in at the end. First of all, this is stuff that you can do on your own at home, and it might work for you. However, if you think you need a little bit more guidance, you may want to go into a chiropractor or physical therapy office to get treatment for this. But since we are kind of going into that social distancing period with COVID-19 going around, I wanted to also extend the offer that if you need help managing this virtually, I feel very comfortable doing that. I actually started having virtual patients today for various cases, just got off the computer with a groin pain patient. So go ahead and reach out to me if you think that you might need help with this. We can totally manage it online. It would be really easy, and I don't need to be in person to try to help you with this. So reach out. Thank you. Happy St. Patty's Day.